Today, we are getting right under the skin of one of the most common conditions on the planet, acne. I mean, it affects pretty much everyone at some point, right? But the actual story of how a pimple forms, well, that's a fascinating biological drama that starts deep, deep inside a single tiny pore.
Okay, so let's just dive right in. We've all had that moment. You wake up, you look in the mirror, and there it is. And you just have to wonder, what is actually going on under my skin to make that happen? That is the exact question we are going to unpack today.
First things first, let's get our terms straight. What we all just call acne is medically known as acne vulgaris, and it's a chronic disorder of something called the pilosebaceous unit. Now, that's just a fancy way of saying a hair follicle and the little oil gland that's attached to it. But here's the most important takeaway. This is a medical condition. It is absolutely not about being dirty or not washing your face enough.
So how does this whole process kick off? Well, it turns out a breakout isn't caused by just one thing. It's really more like a perfect storm, a kind of conspiracy of four key things all happening at once inside that tiny pore.
You know, the best way to think about how a pimple forms is like a line of dominoes. It's this perfect chain reaction where one event triggers the next, and that triggers the next, leading you from a perfectly happy pore to an inflamed blemish. So let's break down exactly how those four dominoes fall. The very first domino to fall is oil, or as it's technically called, sebum. Sometimes our hormones, especially ones called androgens, can basically hit the accelerator on our oil glands. This sudden overproduction of oil starts to flood the pore, and that creates the perfect setup for what's coming next. Okay, domino number 2. This is where we get a kind of cellular traffic jam. The skin cells that line that follicle, they're called keratinocytes, they start to grow way too fast, and they get all sticky. So instead of just shedding like they're supposed to, they clump together with all that extra oil and form a plug that literally seals the pore shut. So now you've got this sealed-off little cavern full of oil. Well, it turns out this is the absolute perfect home for a type of bacteria that normally just chills out on our skin without causing any trouble, Ketibacterium acnes. In this new oxygen-free, food-rich spot, their population just explodes. And here it is, the final domino. Your body's immune system is not going to just sit by and watch this bacterial party happen. It detects this overgrowth and sounds the alarm, sending in an army of inflammatory cells to fight back. And that battle, that's what causes the redness, the swelling, and the pain that we all recognize as a pimple. So that's the 4-step process happening deep down. Now let's connect that to what we actually see on our skin. Because this chain reaction can create a whole range of different blemishes. And trust me, not all pimples are created equal. Every single blemish starts out as that same simple clogged pore. But from that point, it can go down one of two very different roads. And it all boils down to your immune system. Is it just a quiet little blockage, or does your body decide to declare all-out war? This is what creates the whole spectrum of acne. On the quiet, non-inflammatory side of things, you get your basic whiteheads and blackheads. But the moment the immune system kicks into high gear, that's when you see the red, angry, inflamed papules and pustules. And in the more severe cases, you get those really deep, painful nodules and cysts. Okay, this is the cool part. Now that we understand those 4 root causes, we can look at the treatment playbook. Because the entire strategy behind treating acne is to interrupt one or more of those 4 dominoes before they can fall. This really gives us the perfect strategic playbook. You can see how every common treatment has a very specific mission. You've got retinoids, which are sent in to fix that skin cell traffic jam. Benzoyl peroxide, its job is to go after the bacteria. And something like salicylic acid acts kind of like a drain cleaner to unplug the pore. It's all about picking the right tool for the right job to disrupt the process. Of course, sometimes for really stubborn or severe acne, what you put on your skin just isn't enough. That's when doctors bring in the bigger guns, oral medications. Things like antibiotics or hormonal pills work from the inside out to disrupt that acne process on a whole body or systemic level. But among all the treatments out there, there is one that's really in a class of its own. It's known for its incredibly comprehensive approach, and it's usually reserved for the most severe and resistant cases of acne. And that number right there, 4, that is the key. Oral isotretinoin is totally unique because it is the only single medication that hits all 4 of those root causes we talked about, all at the same time. This is what makes it so incredibly powerful, but it's also why it's a serious medication that requires very close medical supervision. So, where are we headed? I mean, are these the treatments we're going to be using forever? Well, not exactly. The world of dermatology is always moving forward, and researchers are constantly looking for smarter, more targeted ways to deal with acne. So, what's on the horizon? Well, a huge focus is on finding ways to use fewer long-term antibiotics because of the growing problem of resistance. That's sparking all sorts of innovation into new things like antimicrobial peptides. The future really seems to be about smart combinations of therapies, plus a much better understanding of how our own lifestyle, things like diet and stress, fits into the whole puzzle. And that really leaves us with a final, pretty exciting thought. We've gone from just kind of understanding acne to being able to strategically target every single one of its causes. So as that science gets even more precise, you have to wonder, are we on the path to a future where breakouts aren't just something we manage, but something we can actually make a thing of the past?